Thank you, Deputy Speaker. I rise today to also contribute to the Social Services Regulation Bill 2021, and I would like to start by acknowledging the Minister and his staff that have developed this legislation. The work they do in this critically important portfolio is to be commended. They ensure the safe delivery of services for some of the most vulnerable in our society, and providing a voice and showing dignity to those who are in a susceptible situation in their lives is at the heart of the Labor Party values. It's the reason so many of the Andrews Labor government members have entered a public service, standing up for the rights and dignity of workers, families, individuals, and those who traditionally have not had a voice have been heard and represented by the international labour movement. The support and solutions to many of our societal changes can't just be solved by just throwing money at the problem and hoping it will go away. Providing support and acknowledging the dignity of the human being must be the start of every solution. We have already heard from many speakers about the reforms outlined in this bill, and I commend those contributions. The overwhelming majority of services providing support to Victorians when they need it do so with these same principles of human dignity at their core. Likewise, the people who enter into the sector to provide the support. That is one of the truly privileged experiences that I have had, and I'm sure that many of my colleagues would agree, is meeting the many charities, individuals and groups in their electorates, and in particular in mine and beyond, and see the wonderful work that they do. And I'm reminded of constituents of mine like Ravinda Kaur, who created the Remat Sandhu Foundation in memory of her son who passed away in December 2014. Ravinda, who was a 2019 Premier's Volunteer Champions Award recipient, has dedicated her foundation to helping the vulnerable in her community. Her foundation is now providing support services for people living with a disability and mental illness. The Melton Combined Churches have worked with my office and the manager, Denise Morris, having a fantastic relationship to help many vulnerable people who need access to support. That might come through services like Hope Street that provide a first response youth service in Melton, along with other needed homelessness support. I've worked with the CEO, Donna Bennett, to help support their valuable outreach. Numerous constituents have been helped in my office through SASH's, Salvation Army Social Housing and Support Network, from veteran services like the Melton and Districts RSL and the Bacchus Marsh RSL, all the support that they provide to their community members. From the numerous disability support organisations in Melton, I thank them for all of their efforts. I'm also thrilled with the announcement from the Minister for Prevention of Family Violence that Melton will receive access to the Orange Door network and that more quality social services are being delivered to the Melton community. These and many other individuals, groups and organisations provide so much support for our Victorians in need. And I'm constantly amazed at the services that are available in the Melton electorate that you just wouldn't know about otherwise. Of course, all these individuals and organisations that have their clients' and families' dignity and well-being as a priority, they need our support so that they can continue their fantastic work. It is important that there is clear and understandable regulations and expectations and not duplicate red tape to manage. We in this House have a duty to support all of those who help others. Unfortunately, there are at times individuals and organisations that don't have their clients' well-being as a priority. They don't respect their dignity. For some of these unscrupulous providers, it is clear to me that their only priority is a financial benefit to themselves at the detriment of their clients. Their concern is to provide as little as possible to others to gain as much as possible to themselves. During my short time representing the constituents of Melton, my office has been contacted dozens of times about a particular facility. The multiple individuals who have reached out to me are good, decent people who have had solid track record of helping the less fortunate in our community over many, many years. The particular facility that comes to mind has been reported to me regularly. The key concern is that it is a profit-centric at the detriment of clients' well-being and dignity. It has had deaths in their facility in tragic, but I believe preventable circumstances. My office has heard complaints of this facility not providing adequate nutrition to people with complex dietary requirements, including diabetes. There have been allegations of them dangerously withholding food from clients for perceived disciplinary reasons. There have been allegations of residents being both physically and emotionally abused, prevented from leaving and having family prevented from visiting. And there are allegations of NDIS fraud, while their facility can only be described as filthy and the provisions in the rooms being clearly unfit for purpose. Multiple charitable organisations have told me that they have stopped referring clients to this facility. Some have prevented their volunteers and workers from entering, as it is deemed unsanitary. My office has helped one of these residents who was absolutely desperate to leave this facility and reported to us that they were prevented from leaving. This to me is a clear example of where the changes outlined in this bill would clearly benefit the clients in this circumstance whose dignity and welfare have been endangered. A high-quality regulatory framework for social services, as suggested, would provide the foundation for improved responses to risk of harm to people who use social services, like the situation that I've described. If the allegations made about this facility are substantiated, then clearly there is a need for exclusion of people who perpetrate such appalling behaviour. They must be excluded from replicating their dangerous behaviour in other facilities or subjecting other vulnerable clients to such degradation. Reading the Minister's second reading speech, it stood out to me that there are relevant reforms contained in this bill that would be applicable in the mentioned example. The Minister highlighted that the inadequacy of the underlying legislative framework has meant avoidable harms have continued, with the regulator having little, if any, ability to intervene at any early preventable stage. Having the many complaints about this facility being highlighted at any earlier period rather than relying on a cyclic review could prevent harm. This bill will establish a new independent social services regulator. It will create obligations for in-scope service providers to be registered and comply with an enhanced outcomes-focused set of standards. It will establish a worker and carer exclusion scheme that removes workers and carers who pose an unjustifiable risk to service users from high-risk roles. And it also establishes a contemporary regulatory framework with a full suite of compliance and enforcement tools, mutual recognition and broad information sharing powers to reduce regulatory duplication and administrative burden on service providers. While current regulation seeks to protect people from abuse and harm, stakeholders have repeatedly identified gaps, overlaps and duplication, and reported confusion about regulatory requirements. As part of these reforms, we are using best practice regulation that starts with clear objectives and expectation, and it applies a risk-based approach to monitoring whether they are being met. Best practice regulation also involves the regulator having access to comprehensive toolkit. This allows it to respond to risk in timely, targeted and proportionate manner. And using a risk-based approach, the regulator can focus its attention where the likelihood and consequences of harm are greatest. And this reduces compliance burden by managing regulatory activity where these risks are relatively low. The creation of an independent regulator is a key feature of this bill, and I think a sensible reform, and the need for a regulator separates from the department that also provides essential oversight. Shining light on concerns early and putting clients' needs at the forefront is essential for the outcome of the clients. The new independent regulator replaces the human services regulator that is currently within the Department of Families, Fairness and Housing. And the independence of that regulator provides decision-making separation between the regulator and the department, which is particularly important where the department is delivering the service. And this has been welcomed by the sector itself. In regard to the exclusion provisions I mentioned earlier, I note that the bill will establish a worker and carer exclusion scheme that removes workers and carers who pose an unjustifiable risk to service users from high-risk roles. The new worker and carer exclusion scheme will replace the current carers register and will be administered by the new social services regulator. When the scheme is commenced, service providers who are engaging workers and carers to care for children and young people who are within the child protection system will need to confirm the worker or carer is not listed on the exclusion register. I'm encouraged to see the reforms highlighted by the Minister in this bill, and I feel that the reforms will provide safety and better quality of care for Victorians, and I commend this bill to the House.